Caring for a newborn challenges every parent, but for some, the standard rulebook must be thrown away. For a baby with epidermolysis bullosa, or EB, a simple adhesive bandage is forbidden. It would rip their skin clean off. Their skin is as delicate as a butterfly's wings. The slightest friction causes excruciating open wounds. This fragility means standard handling, dressing, and even comforting are not just unhelpful, they are dangerous. We will show why this specialized care is a life or death necessity, covering wounds, pain, nutrition, and the team required. So, what happens when these butterfly babies are born in a standard hospital? Staff often lack experience, creating a crisis of confidence. First instincts are wrong. Babies cannot be nursed naked. Soft, inside-out clothing acts as a necessary shield. Next, bathing is forbidden until birth trauma heals. Wound care is done limb by limb to minimize handling. Even the air is a factor. Overheating weakens the skin further, directly increasing the rate of blistering. Epidermolysis bullosa isn't one disease, but a group of genetic disorders. Severity varies widely, making an accurate diagnosis by specialists vital. Despite every precaution, blisters are inevitable. But how they are treated is a specialized science. Standard wound care does not apply. A blister can't be left alone as it spreads into a larger wound. It must be lanced, but the blister roof is kept intact as a natural barrier. Dressing the wound is a multi-step process. The first layer must be non-adherent, like soft silicone, so it won't fuse to the raw skin beneath. On top of that, foam dressings add padding and absorption. This is about preventing new injuries from pressure as much as it is about healing. This whole process is intensely painful. So how do you manage an infant's severe, constant pain when you can barely touch their skin? You're about to find out. For parents, wound care is a daily distressing ritual that can take hours. It is a lifelong burden requiring immense emotional and physical resilience. Pain management cannot be reactive. It must be proactive. It begins with a baseline of scheduled analgesics, often paracetamol combined with oral morphine. For the sharp pain of dressing changes, specialists use concentrated sucrose. This multi-drug strategy addresses both background and procedural pain. For severe pain, intranasal fentanyl can be used. It gives fast relief without the trauma of an injection or touching the damaged skin. But managing the skin is only half the battle. A hidden crisis is happening inside the body. What is the link between constant wounds and a baby's growth? Constant wound healing is like running a marathon 24/7. This hugely increases an EB baby's caloric needs, pitting the body's healing process against its growth. But getting those calories in is an immense hurdle. The same fragility affects the mouth and esophagus, causing blisters that make feeding agonizing. This demands specialized tools like soft-tipped feeders to bypass painful areas and get nutrition in. In severe cases where swallowing is impossible, a gastrostomy tube is the only option to deliver nutrients directly. The result of this is rampant malnutrition. One study found over 82% of EB patients suffer from it, causing wasting and stunted growth. So you have complex wounds, specialized pain management, and a nutritional crisis. Who coordinates all this? Can a single pediatrician possibly manage it? Remember the crisis of confidence for hospital staff? This is why it happens. No single person can manage EB. The only effective approach is a coordinated team. This required team includes a dermatologist, a specialized EB nurse, a dietitian, a pain specialist, a geneticist, and a psychologist. This team doesn't wait for the patient. Specialized centers send them to local hospitals because transporting these fragile infants is too risky. This team-based system is the definitive answer. It addresses the skin, the pain, the nutrition crisis, and the initial knowledge gap all at once. Beyond the medical issues, there is a profound human toll. Parents need immediate psychological support to cope with the overwhelming reality of the diagnosis. Specialized care for EB is not a collection of tricks. It is an integrated system. It replaces standard practices with protocols that protect, heal, and nourish. It is fundamentally distinct from general pediatrics. This distinction is the line between a life of constant pain and a chance at growth and comfort. Understanding this difference is the first step to advocacy. Share this video to raise awareness for butterfly children and the specific care they need. For epidermolysis bullosa, specialized care is not the best practice. It is the only practice.